When we created the Youth Health Champions program, the vision was clear. It was to create a space where young people could step into leadership, where they could raise their voices and reimagine what health equity looks like. And over the past months, they've done just that and a bit more. They've done stuff that was quite beyond what we could have imagined. They've showed up time and time again, and they started naming the ways that anti-Black racism shapes healthcare. They started redefining what equitable care looks like and could look like. And with that, they began charting a different path forward. But rather than me telling you everything they've done over the past couple months, I want you to hear directly from them, from our very first ever Youth Health Champions cohort. They're going to be sharing their journeys, lessons learned, and their hopes for the future.
Being a part of this program has been amazing, and each session was just incredible. So it was hard to choose just one. The session that had the biggest impact on me was Dr. Osmond's session, which focused on the history of anti-Black racism and slavery in Canada. That's a topic that was never really spoken about in my schooling growing up, so it really opened my eyes and has pushed me to further educate myself on Canada's history.
Throughout this program, we've had several insightful sessions. As I advance in health equity after this program, I would say that I will most definitely retain with me that storytelling needs to be done with intention and strategy to spark change and carry long-lasting impact.
One key thing I'm taking with me is that my voice matters, and I've learned to speak boldly and use storytelling as a tool to inspire change and stand up for health equity and equity in my community.
One key takeaway from this program for me that I will use to advance work in health equity in my community is the power of education, community, and leadership. Education, because it is important to understand the root of the issue and how it became an issue, as well as having the knowledge and wisdom to correctly address it. Community, because without the help of our community, we cannot find sustainable solutions. And then leadership, because it takes courage and leadership skills to turn ideas into action.
Inspired by Jasmine as well as the other guest speakers in our cohort, I feel more capable of challenging unjust systems and working towards a better healthcare environment for everyone. I'm extremely grateful to Black Donor Save Lives for giving me the tools and the confidence to use my voice to create meaningful change within my community.
One of the key takeaways also for me from this whole program, I think, was just the importance of really knowing your history behind the disparities that we see right now, to have good conversations with people, and also to be able to make serious change in those areas.
And one key learning I'll carry forward, that leadership is rooted in courage, humility, and willingness to speak out for voices, often silenced. How small actions grow into global change, but it's also creating space for others to lead. And we use those lessons in my work with Black Donor Save Lives and build trust through storytelling, challenge systems, and advance health equity. Thank you for your attention.